doctor, but she always makes her own ice rink as well. It's Dr. Marjorie Dixon. I'm impressed. We're all like, oh, that's such a dude thing. Yeah. Not for Dr. Dixon. She does her own.
Quebec, man. Everybody
That's
has
true.
an ice rink. I played ringette. Do you even know what that is?
Yes, I do.
Okay, just checking.
That's amazing. Good for you. You're a winter gal.
Winter chick.
Now, we want to talk a bit about the body image when you are having a baby. So, you know, women take a hit on their body image all the time. But when you're having a baby, it can be an interesting time in your life. You've probably never gained that amount of weight in that short amount of time before.
Yeah.
And your body is truly quite alien for 9-10 months of your life. So let's talk about evaluating the baby bump. Everyone has a different bump.
Yeah.
It's a different size.
Yeah.
I wanted to have the 2 stick legs with just a basketball in my belly.
Yeah,
It didn't work out like that.
It didn't happen to me either. It
So-
doesn't happen to most women. And I think that what's interesting about the baby bump is, you know, people say all kinds of things about baby bumps, but there are some interesting information that can be gleaned from a baby bump from a physician's perspective and from a healthcare provider perspective.
Okay.
So it's not just like you look at it and you say, that's a pretty baby bump. You look at it and you can kind of start to assess certain things. For example, when you go to your doctor prenatally and you're having your visits after about 16 weeks, they start taking a tape measure out. The thing they're not undertaking, they're actually going to measure from your symphysis pubis, so from your pubic bone, up until the top of your uterus. And there are different milestones that you're expected to achieve to show normal growth. But of course, that's growth with one baby, right? So if there's more than one baby, it looks different. If the baby is in a different lie in the pelvis. So women have different shaped pelvises, right? Some women have what we call a gynecoid pelvis. The pelvis is nice and open. Some have a platyploid, which is flat, or android, which is more like a guy-shaped hip pelvis. And babies will sit differently in those types of pelvises. So what people see on the outside and have started to say, oh, that's a boy, or man, you're looking big, or oh, that's really small. Well, yeah, but it also means different things. And only a healthcare provider can really make a woman worry or not worry about the significance of it.
And that's why they're measuring it, because they know certain things. They're looking for certain
growth parameters
milestones.
for the baby. So you're looking for milestones. So it should be at the umbilicus, you know, at 24 weeks, at the belly button at 24 weeks. It should be at the xiphoid process, you know, the edge of your rib cage, at 37 weeks. Optimally. But now we also have other tools. We have ultrasound to see baby growth. And then there are other reasons. If you have more than one baby, then it's going to do different things. You'll look bigger sooner. If you have a fibroid on your uterus, a lot of women have fibroids, you'll look more pregnant sooner. And not everybody really wants it to be pointed out that you're due
any day now.
I know, right?
And it's like, no, actually, I have 3 months to go.
Exactly. And then different pregnancies. So when you're your first baby and your muscles are taut and you haven't had, you know, we've talked about this in the past with something called diastasis recti. So the muscles come apart and whoop, the uterus comes out sooner, so you look more pregnant sooner. But in that first pregnancy, when everything's just being trained to stretch a little and you look kind of like you might have some gas instead of really having a baby, and people not really, you look cute and you look cuter longer. And if you think about, you know, the next baby, so for me, I've had 3. So the second baby, people kind of were like looking at me differently sooner because my muscles had relaxed, so my abdominal wall was used to the idea of getting distended. And then by the 3rd baby, I just, whatever. Because I gained 70 pounds every time. I was like, it is what it is. So it depends on how many babies, where you are in your pregnancy, if you have fibroids, if there's lots of fluid, if there's too little fluid, all of these things will impact what your baby bump looks like.
We are, you know, more and more influenced by the images that we see on television and on film. And you know, a lot of these Hollywood actresses and singers are walking around with the 2 stick legs and the perfect basketball belly.
It's orchestrated though. So
how does that happen? Is it just that they just eat lettuce for 10 months, or like why is that happening?
Every pregnancy starts out small. So when they first published that, whatever, they put it on Facebook or Twitter, the shot where they're like all cute. So they'll do that at 16 weeks. They'll do that early so that they'll look pregnant enough. And then they kind of often go into hiding. Have you not noticed? You sometimes see people and then they go away, and next thing you know, they have the baby, and then you see them 3 months later. It's all organized, and they take the right pictures, but we don't realize, you know, TV's orchestrated. Media things can be orchestrated. So
I wish I could have orchestrated mine.
I know, man. I know. And
I had to keep coming in here.
Everybody was able to document it, right? It's like I had a lab coat that I would wear over my, because I didn't want ever to be in everybody's face. I'm in a fertility clinic, right? And at the, it was funny because then I'd go back after I had the baby and people were like, you've lost weight. You were really fat before, hey? And I'm like, actually, I was having a baby. so I think that people do share, but if you think about the Hollywood, the way that everything's organized, so we can't hold ourselves to that. And you know what, some people are just genetically that way. Like, I have friends who are not Hollywoodites, but who have skinny little legs and had little basketballs and whatever you know who you are. I'm not your friend anymore, but you know, like that. I'm kidding. I'm still their friends. But the different people have different. It didn't happen to me. It didn't happen to you. We gained weight.
We've got pictures of you, actually.
Yeah.
So, and you're gorgeous.
I will. So this is. We can play a game.
Yeah. So your first picture is how many months pregnant are you?
So you have to guess how pregnant. Guess how pregnant I was in there.
I don't know.
It's my third pregnancy.
6 months.
Thanks. I was 4.5. So but that's it. So there. Guess how pregnant. This is different pregnancy.
I don't know. Same.
I gave birth 4 days after that shot. See? So the second baby, I got bigger later.
Yeah.
The third baby, I was like, we better take these pictures now because I know where I'm headed.
You do the test and you're like, hey, can we do photos now?
Yeah, so that's just to say.
I found out yesterday, let's do the photos today.
Right?
Yeah.
And then the whole thing about being able to tell whether it's a boy or a girl, people walk up. I was on a cruise and a drunk lady walked up to me. No, really. It's a cruise. They had buckets of beer and a football helmet. I'm not making this up. And she walks me, she goes, oh, you're having a baby, so nice. And I'm like, yeah, I am. She goes, how pregnant are you? I'm like, I'm only 4 months pregnant. She's like, you're not 4 months pregnant. You're gonna give birth any minute. And I'm like, really? Like, okay. This is a true story.
People take liberties when you're having a baby. So we are going to talk about some of your comments. We went out on social media and we've all been through it. We're going to do that later in the show, so stay tuned for that. Thanks.